So now let's talk about spleen. So first, we need to know the important function of spleen. So the most important function of spleen is to filter and clear old and misshaped RBCs and platelets. And another function of spleen is similar to the lymph node, all right? It initiates the humoral response. So you need to understand how spleen clears and filters misshapen RBCs. So misshaped RBCs, they cannot bend or they are not flexible like the normal RBCs, all right? And in spleen, there are these really narrow arterioles in the red pulp. And if the RBC is abnormal, it cannot squeeze through these narrow arterioles, all right? And when they cannot squeeze through, they get stuck and they are cleared by the macrophages, all right? That's how misshapen or old RBCs and platelet are cleared via spleen. Now, similar to lymph node, it is really important in initiating the humoral immune response via B cells and T cells. Now, another really high yield point from exam point of view is the location of the spleen. The spleen is located in the left upper quadrant, all right? And if there is a question about trauma, and if the impact is on the left side of the body, we have to be suspicious about the splenic rupture, all right? And if there is particular mention of the fracture of ninth, 10th, and 11th ribs, then you have to be more careful about the risk of splenic rupture, all right? So let's look at the structure of the spleen. So the structure of the spleen is divided into red pulp and white pulp. So here I have highlighted this small section which shows both the red pulp and the white pulp. All right. So this area outside is the red pulp. All right. And this whitish peel structure is the white pulp. That's why they are called white pulp and the red pulp, right? So I've highlighted this structure which shows both the white pulp and small part of the red pulp here. All right. The white pulp is divided into follicles, or which are also known as the B cell zone. All right. The follicle are known as the B cell zone. And there is a T cell zone as well. Now you can imagine that B cell zone or the follicles have a lot of B cells, right? That's why they are called B cell zone. And the T cell zone has huge storage of the T cells. Now the follicle has a germinal center where the major activity or the major activation of the B cell occurs. So this is the germinal center where the active B cells are present, all right? And this is the marginal zone. Now let's look at these structure in more detail. So the white pulp is the reason where antigen filtration and presentation occurs. Now you can imagine that the white pulp has both the B cell zone and the T cell zone. So it's obvious that antigen presentation occurs here. All right. Now, like I said, this lymphoid follicle is the B cell zone. It has a lot of B lymphocytes. Now, T cell zone is also called periarteriolar lymphatic sheath. All right. And this marginal zone contains the macrophages and specialized B cells. All right. So when B cells are differentiated into effector cells, they're present here. So the specialized B cells are present in the marginal zone and it contains a lot of macrophages. Now you can imagine that antigen capture, all right, occurs here. Why? Because it has a lot of macrophages and B cells. So antigens are captured here and then they get presented and the B cells are activated in the germinal center. Now let's look at the red pulp. So red pulp is the area here, all right, outside the white pulp. So the white pulp is present more centrally and the red pulp is more on the outside of the white pulp, all right? So this is the red cell zone, all right? And it is involved in the capturing of the abnormal RBCs and platelets. Like I talked earlier, if the RBCs are misshaped or if they are old, they cannot squeeze through the narrow arterioles, all right? And then they are captured by the macrophages and they undergo phagocytosis. Now, splenectomy. This is super high yield from exam point of view because you'll get a lot of questions about splenectomy. So the most common conditions for splenectomy are trauma, sickle cell disease, thalassemia, hereditary spherocytosis, and refractory ITP. We won't be going detail into the absolute indications and, in detail of these diseases because it's not the scope of this video. All right. So these are just common conditions where splenectomy is necessary. Now, super high yield point from exam point of view is how our body adapts or what are the changes in our body after splenectomy. This is super high yield. Now, spleen is such an important organ for our immune system, right? It's a really important place where antigens are captured, where bacteria are destroyed, all right, where a lot of phagocytosis by macrophages occur. Another reason why spleen is important because it contains a large pool of B cells and T cells. And when we remove this large pool, there'll be deficiency of B cells, all right? And when we remove this large pool of B cells, obviously the IgM production is going to decrease, all right? Now, when IgM production is decreased, obviously the complement activation won't occur because we don't have this IgM. All right. And IgM and IgG antibodies are one of the most important antibodies for complement activation. Without complement activation, there won't be C3b opsonization because remember, C3, complement C3b is an opsonin. All right. It tags the cell or abnormal cells and bacteria so that the macrophages and natural killer cells recognize them and they can phagocytose them. All right. So there is decreased clearance of opsonized bacteria because there's no opsonin. All right. There's no C3p. So this increases the susceptibility to infection, especially by the encapsulated bacteria, because clearance of encapsulated bacteria depends on opsonization and phagocytosis. Without opsonization, the macrophages and natural killer cells, they cannot recognize bacteria, all right? So phagocytosis will be impaired. And this is one of the most important defense mechanism to destroy the encapsulated bacteria. So without spleen, there's increased risk of encapsulated bacteria. Super high yield from exam point of view, all right? They love to test you about decreased IgM production, decreased complement activation, decreased opsonization after splenectomy. So you need to understand this concept. IgM production is decreased because there's decrease in B cell, all right? And without IgM production, there won't be enough or adequate complement activation, decrease C3b, and without C3b, there won't be opsonization.